Oui, allez-y, docteur.
Go ahead, Dr. Njoo. I apologize. Hello, everyone. Nationally, and in most health regions, COVID-19 disease activity remains at much reduced levels. Total active cases and average daily cases are 95% lower than the peak of the third wave, with less than 420 new cases being reported daily. Severity trends continue to decline, with, on average, 85% fewer people in hospitals with COVID-19 daily than at the peak of the third wave, and an average of 9 deaths reported daily. To date, almost 44 million doses of COVID-19 vaccines have been given in Canada, which equates to over 26 million, or 79% of people aged 12 years or older in Canada with at least one dose. Since this time last week, the proportion of people 12 years or older who are now fully vaccinated has increased from 44% to over 52% and climbing. As we continue to make good progress towards protecting people, livelihoods, and futures in Canada, we are aiming to build the vaccination firewall high enough to prevent severe illness outcomes and resume indoor education, business, and recreation this fall and winter. While we have many weeks of summer left to enjoy, it is also an important time to get ready for all the opportunities that lie ahead of us. With under 8 weeks to go before Labor Day, getting vaccinated is one of the key preparations to not delay. In particular, for all those who are eligible but have yet to receive the vaccine, time is of the essence to get a first dose and be on track to be fully vaccinated by the fall. During these crucial next weeks, public health at all levels are honing in on targeted supports to get more Canadians protected. The current epidemiology in Canada and worldwide shows that the vast majority of cases, hospitalizations, and deaths are occurring in unvaccinated people. Asymptomatic and mild illness is still a feature, particularly in younger people, but no age group is immune to severe illness due to COVID-19, and anyone can spread the illness to others, even if they aren't showing symptoms themselves. This is why vaccination is important for every eligible age group. In particular, as infection rates are still highest among those under 40 years of age in Canada, increasing vaccine coverage in younger age groups can have a big impact on COVID-19 control across communities. This is also needed for the protection of those who are at a high risk, including those who can't be vaccinated, such as young children. For everyone who is not yet vaxxed to the max, this is a call for arms. You are needed in raising the firewall. Please step up, ask the questions that you need answers to. Find the time and seek out supports in your community to make this happen for you, and commit to joining the collective Canadian effort to protect ourselves and those around us, and to get back indoors together this fall. Thank you. Merci. Miigwech.
Merci beaucoup. Merci beaucoup.
Thank you very much, Dr. Njoo. We're now going to turn the floor to Brigadier General Brodie.
Merci. To date, we have brought in almost 56 million doses of COVID-19 vaccines across Canada in support of provincial and territorial vaccination campaigns. This week's Pfizer-BioNTech deliveries of 1.4 million doses were completed yesterday. We expect to receive large shipments over the next 2 weeks to meet our Pfizer-BioNTech forecast of 9.1 million doses for this month. We will also be receiving 2.1 million Pfizer-BioNTech doses the first week of August. Additional delivery schedules for both Pfizer-BioNTech and Moderna are being discussed, and more information will be forthcoming in the weeks ahead. In the coming weeks, we will cross a symbolic threshold of 66 million doses, signaling that there are enough doses in Canada to vaccinate every currently eligible Canadian. As we pivot from limited supply to sufficient supply, we are implementing a more nuanced approach to ensure that the vaccines are stewarded in a manner that best supports Canada's enduring domestic needs, as well as optimizes options for supporting global vaccination efforts. As briefed in previous weeks, we will continue to offer provinces the option to hold doses from their initial rollout allocations in central inventory, along with a small, carefully curated strategic vaccine supply at the federal level to meet emerging needs. This allows provinces and territories ready access to vaccines as they need them in the months ahead. We have traveled far on this COVID-19 vaccine distribution journey since December 2020. I am tremendously proud of the work of the team and our partners to date, and we will continue to adapt our distribution and inventory management approach to best support Canada's COVID-19 vaccination program. À ce jour, nous avons...
To date, we have brought in almost 56 million COVID-19 vaccine doses across Canada in support of provincial and territorial vaccination campaigns. This week's Pfizer-BioNTech deliveries of 1.4 million doses were completed yesterday. We expect to receive significant doses of Pfizer-BioNTech in the next 2 weeks and 9.1 million doses of Pfizer-BioNTech for this month. We will also be receiving 2.1 million Pfizer-BioNTech doses the first week of August. Additional delivery schedules for both Pfizer and Moderna are being discussed. More information will be forthcoming in the weeks ahead. In the coming weeks, we will cross a symbolic threshold of 66 million doses, signaling that there are enough doses in Canada to vaccinate every currently eligible Canadian. As we pivot from limited supply to sufficient supply, we are implementing a more nuanced approach to ensure that vaccines are stewarded in a manner that best supports Canada's enduring domestic needs, as well as optimizes options for supporting global vaccination efforts. As briefed in previous weeks, we will continue to offer provinces the option to hold doses from their initial rollout allocations in our federal supply, as well as a small, carefully curated strategic vaccine supply at the federal level to meet emerging needs. This allows provinces and territories ready access to vaccines as they need them in the months ahead. We have traveled far on this COVID-19 vaccine distribution journey since December 2020. I am tremendously proud of the work of the team and our partners to date. We will continue to adapt our distribution and supply management approach to best support Canada's COVID-19 vaccine program. Thank you. Miigwech.
Thank you very much, General Brodie. Alors, Jean-Sébastien, à vous, on est...
Jean-Sébastien, the floor is yours. We will be more than happy to answer questions.
Any questions? So, Jean-Sébastien, over to you.
Merci beaucoup, Monsieur le Ministre. Donc, nous allons maintenant débuter la période de questions. Ministers, the Brigadier General and Dr. Njoo will now be happy to take your questions. And I should also say that Madame Paquette from PSPC is there to take your questions as well. So, as usual, it will be one question and one follow-up. Comme d'habitude, ça va être une question et un suivi par journaliste. And I will now pass it over to the operator for the first question. Je vais maintenant passer la parole à l'opératrice pour la première question.
Thank you. Merci. Please press star 1 at this time. If you have a question, veuillez appuyer sur étoile 1 maintenant pour toute question. Our first question, notre première question, nous vient de Mia Rabson with the Canadian Press. Please go ahead. À vous la parole.
Nuanced approach to distributing vaccines. I'm just wondering if you can give a bit more information about what that means, particularly as it relates to helping global supply of vaccines and what sort of that entails, and how many doses Canada sort of is now holding back and has not distributed to the provinces.
Ms. Rabson, it's Dominic Leblanc. You were cut off. I couldn't hear the very first couple of sentences of your question. Perhaps, I just want to make sure it sounded like General Brodie or Dr. Njoo could give you the precisions you're looking for. Perhaps you could just pose the question. I want to make sure we understood the first couple of sentences.
Yeah, for sure. I'm just wanting a bit more detail on this nuanced approach that Brigadier General Brodie talked about in terms of distribution as it relates to helping the global supplies.
So, General, go ahead, and if Dr. Njoo wants to add something.
Thank you. What we're doing now is managing our vaccine supply in a very strategic way that allows us to ensure that the provinces have the doses that they need on hand and readily accessible, while minimizing wastage and optimizing our ability to transition doses for global donation as the provinces signal that they no longer have a requirement for those doses. And I think you had asked a question regarding how many doses are currently sitting in central inventory. So at this point in time, we're managing about 2 million doses on behalf of the provinces. So these are doses from their initial deployment allocations that they've indicated that they would like us to manage centrally so that they can pull them down at the time and place of their choosing as their programs indicate that they're ready to accept those doses. Thank you.
Thank you. And just wanted to clarify that 2 million is on top of the Federal Reserve doses you talked about. But this is probably a question for Minister Leblanc. Are we planning to stockpile doses of vaccine in Canada, sort of awaiting kids being approved later this year, rather than donating them to countries who might be able to use them immediately?
So thank you for the question. I'll offer some comments, and perhaps Dr. Njoo or others are in a position to add something. We have said from the very beginning, the most important responsibility we as a national government have is to ensure that we quickly, safely, and successfully procure the necessary vaccine doses to ensure that every eligible Canadian who wants one can have one as quickly as possible. And from the numbers that General Brodie shared or Dr. Njoo, I think you can conclude, as we have, that the vaccine deployment effort has been successful. Our provincial and territorial partners have done a very considerable job, very effective job in immunizing their populations. We have also said, and we've seen months ago, some of the challenges of a global supply chain and the global pressure on these large pharmaceutical companies in terms of procurement. So we will be very prudent in ensuring that we always have access to all the necessary vaccines to immunize Canadians. And your question, I think, is very valid. If, for example, Health Canada grants approval based on some trials that are underway now, for younger persons to be vaccinated, we would obviously want to very quickly have the vaccines necessary for provinces and territories to begin immunizing younger people. Dr. Njoo said that Labor Day is less than 8 weeks away. Kids will be going to school. Obviously, if the regulator, if Health Canada determines that it's safe to administer vaccines to persons younger than 12 years old, our job as a national government is to ensure that we have available those vaccines to protect Canadians. So that will always be our primary focus. We will never do anything that will jeopardize our ability to have quickly and safely access to all the vaccines necessary to immunize any eligible Canadian. But as Minister Gould
and language revival